Good morning, everyone, and welcome to today's webinar on managing mental health in the workplace. My name's Allison DeFlorio, and I'm the managing partner of the Human Capital Division here at Exude. And we are so thrilled and honored to have the Beck Institute as our partner for today's webinar. For those of you that may not be familiar with the Beck Institute, they're the leading international source for training, therapy, and resources for cognitive behavioral therapy, or CBT, as you'll hear us referring to throughout the program today. They also happen to be a client of Exude and a fantastic organization that stepped up to our call for support in providing Dr. Alan Miller to be our speaker for today. So my role for today is simply to do a few housekeeping tips for the presentation and to introduce Alan. So a couple of housekeeping tips for everybody. As your phones will be on mute throughout the presentation. We do encourage you to ask your questions, type in your questions, and we will, at the end of Dr. Miller's presentation, have a question and answer period to address all of your questions. That'll be facilitated by our very own Carla Chin, Director of Wellness here at Exude. If you have any technical difficulties, just please use the chat feature, and one of our Exude folks will help address that. So that said, before I introduce Alan, I do want to talk a little bit about why we chose this topic. For those of you that are familiar with Exude, you know that we describe ourselves as all things people. We're a consulting firm with expertise in the areas of employee benefits, wellness and well-being, retirement, human capital, and risk management. All things that have been impacted, certainly, by the events over the last 3 months. We have held a series of webinars for our clients and our community to address the relevant issues that they're facing today. And certainly the increase in issues around stress and anxiety, feelings of isolation, depression, and addiction are issues that our clients have come to us for support and for help. In the last, I'd say, 4 weeks, we've also, as employers have begun to plan for returning to work, there have been increased requests to provide support to managers and supervisors who may have had no training in how to recognize signs of emotional distress, mental distress, much less on what you should say, can say, how can you actively support and guide employees in a meaningful way to the resources that will help them. So our goal today with this presentation is to bring the experts to you. And again, we're thrilled and grateful for providing Dr. Alan Miller. Just a bit about Dr. Miller's background. He's a seasoned clinician, trainer, and administrator who provides oversight to the training and clinical services at the Beck Institute as the CBT Program Director. And for over 25 years, he's held leadership roles in large integrated health systems. He's run employee assistance programs and really has experience from all lenses of this, in a lot of experience in helping managers and supervisors be able to respond appropriately, compassionately, and legally when they see these kinds of issues arise in the workplace. So with that, I am going to turn it over to Dr. Miller to guide you through this presentation.
Thank you very much, Allison, and welcome to all of you. On this discussion about managing mental health in the workplace, which is going to be largely crafted around the current events that we're dealing with in the world today. As Allison said, Beck Institute has the mission to improve lives worldwide through excellence and innovation in cognitive behavior therapy, in training, practice, and research. So with that said, I'm going to get on with it. And I think that it is something of an understatement at this point to say that we're facing unprecedented times. Certainly, pandemic is something that we experienced with the 1918 influenza. We've certainly faced racial violence in the past, and the civil rights movement in the 1960s was fraught with violence of all sorts. And we've certainly had times when we've had cultural changes and breakdowns in societal norms. What makes this especially unprecedented is that we have all three of these things occurring at the same time, which is leaving most of us without a playbook for how to proceed. So my agenda for the next number of minutes is to first of all talk about the impact that trauma has on our lives. And then we'll start with talking about how companies or organizations can take action in regards to their workforce, their employees, their staff members. What does an organization need to do to set the foundation? How do they begin an early prevention process in order to offset long-term trauma for individuals? And how do you go about addressing it when problems for individuals are identified? And then in the second part of this, what I'm going to focus on are some of the cognitive behavior techniques that are available for individuals. Now, when I say individuals, this can mean us as well as our staff and employees, because one of the interesting and unfortunate things perhaps is that we're in this and experiencing it at the same time. So we are not exempt from the traumas that all of our employees and staff are experiencing. So I'm going to talk about some of the things that come from CBT that we can use in our daily lives and that we can pass on to employees and staff members. The things that I'm going to talk about and the way that I'm going to present them are things that anybody can use anytime. You don't have to be a licensed mental health professional in order to utilize these things. So that's my agenda, and I'm going to just get on with it by, first of all, talking about some of the stressors that we experience during a crisis. These are common kinds of things. One is quantity and frequency of information. Sometimes it's just too much, as well as sometimes not enough. But we might experience financial problems, we lose our routines, we have inadequate supplies of things, we have frustration and boredom. At the same time, we're concerned about our own personal safety and health, but we're concerned about our family members, while we lose the social contact and the physical contact with those that we care most about, and we experience a sense of isolation contributed by all of those things. And just in case you have forgotten and need to be reminded that you as an employer or a representative of your employer have a number of special stressors that are emanating from the pandemic and the crisis that we're facing now. Health and safety concerns, there are state and federal guidelines. You need to develop policies and procedures. You need to sort out what is your responsibility in terms of providing PPE, doing testing for temperatures and identifying symptoms. What is your responsibility if employees become sick? What is contact tracing and what does that mean for you as an employer? And how do you take care of your own personal safety and health? So I'm just identifying those as stressors. Now, to add to that, you have your normal operational issues that employees are going to want to take time off. They're going to be working remotely, and you need policies and procedures to help them, to guide them. You will have some employees who will refuse to return to the workplace if they've been working at home or if they've been laid off. We have this special need to assess the quality of the work that's being done by people who are working at home, while at the same time still being mindful of the needs of our customers. And we still have financial targets to try to hit. And we need to reconcile the health guidelines with the need to be productive. So I just wanted to review those list of things in case you had forgotten what it is that is causing a lot of the stress for you right now. So I want to kind of get into talking about what is the impact of trauma on individuals. Because I think it will be helpful for us to understand exactly what it means and the impact that it has before we can talk about how do we want to or can we expect to intervene. So a traumatic event, as defined in the Diagnostic and Statistical Manual published by the American Psychiatric Association, is about when a person is exposed to death or threatened with death or actual or threatened harm. Now, this could be that they're threatened themselves individually, or it could be somebody that they identify with or something that they've observed. And so things related to the pandemic, things related to the violence, related to the racial violence that we see occurring in our world today, and any other kind of violence that would threaten a person are all considered traumatic events. And so any one of those can stimulate any one of a number of kinds of reactions. Generally speaking, the kinds of reactions that people have to trauma will fall into four broad categories. First is intrusions, then avoidance of the trauma, negative alterations in thoughts and mood, and alterations in arousal and reactivity. So what do those things mean? So intrusions mean that after the event itself, people are re-experiencing the trauma by having memories about it, by having nightmares about it, by having flashbacks about it when they're awake, and overall experiencing emotional distress at times that they don't want to be thinking about it, and at times when it's interfering with their normal functioning. So this is intrusions are unwanted thoughts about a traumatic event that a person is experiencing. Next is avoidance. So trauma very commonly is associated with behaviors of avoidance. That is, that people don't want to think about it. People don't want to re-experience the feelings that they have when they were enduring the trauma. And they don't want to go near it. They don't want to be taken to places or being shown reminders of the traumatic event itself. And many times people will design their lives in terms of where they will go, what they will do, what they will read, what they will watch on TV in order to avoid thinking about the trauma. Now, paradoxically, that might be happening at the same time that they are talking about trauma and the negative impact of the events of the day. Negative alterations in cognitions and mood, this is that they begin to have negative thoughts and feelings either during the event or they've gotten worse during the event. Sometimes people who have been traumatized are not able to recall the details of the trauma itself. And people will start to think more negatively about themselves or the world around them. They will feel depression, grief, sadness, experience decreased interest in activities, feel isolated, and have difficulty experiencing any kinds of positive affect or mood. The alterations in arousal and reactivity, they may be very irritable. They might begin engaging in risky or destructive behavior, but they're also likely to be hypervigilant, paying attention to everything that moves and everything that other people are saying. You might have a heightened startle response and difficulty concentrating and sleeping as they try to have a normal life. It can be very difficult for them to do that when they're experiencing these alterations in arousal and reactivity. So what is normal and what is not normal? And this is very important for us to keep in mind at this point in time, because any of the things that I just mentioned in any of those 4 categories or all of those categories are things that anybody who has experienced a trauma may experience. And we would call that normal, that anybody would be having problems in any of those areas. When it starts becoming not normal is more a matter of time. And that is that after a month or so, after the person has experienced their personal trauma, after a month or so, if they're still experiencing all of these symptoms, then we would consider that that would be problematic. And that would be a time that we would perhaps talk about professional intervention. But there are many things that can be done before that time, and we're going to talk about those very shortly. I just want to mention one other thing, and that is chronic stress. And this is where low-level or even high-level stressors continually occur, and people are continually having to adjust, accept, and adapt to stressors that go on over a period of time. And those things too can require and can first of all result in negative reactions, and then can require action to take control. And that quest for control is one of the things that people typically try to do for those things in their environment. The paradox about this is that the relentless pursuit of control is likely to increase in levels of frustration and anxiety. There is much that we do not have control over. In fact, most of the things that are going on in the world around us, we do not have control over. And it takes practice, commitment, and humility for us to accept those things that we cannot control. When we do accept that we do not have control over those things, then we can begin to work on those things that we do have control over. So this is an important thing, though, that some of the behaviors that we do that just a moment ago I said are normal can lead to other complicating problems. So at the same time that somebody might be experiencing the trauma, now they might experience depression. They're sad, they're grief-stricken, they're lethargic, and sometimes feeling hopeless about the future because of the trauma and the impact that it has had on them. So oftentimes we think about depression as a reaction to things that have already happened. Anxiety, on the other hand, is worried about things that we have to face, and that those things are going to be bigger than us, and that we don't have the wherewithal to deal with those things. So what we sometimes do in our avoidance of not wanting to think about it and not talk about it, people will use substances, alcohol, and other substances. In the beginning, again, we will say that that's expected and normal, but it's a very slippery slope, because then, in addition to the trauma, people can develop substance use disorders, eating disorders. When people are stressed, sometimes they eat more. Some people, after experiencing a trauma, will forget to eat altogether. And we don't want either extreme to progress for any length of time. Sleep disorders are very common. And then, of course, if somebody continues to experience the trauma beyond a month, we start thinking about the diagnosis of post-traumatic stress disorder. But when people are dealing with all of these problems, it can have a negative impact on work in terms of decline in performance, how people appear, how they take care of their hygiene or not. They feel disconnected from people. They experience presenteeism, that is, they're there, but they're not able to concentrate, they're not able to pay attention, they're more pessimistic, and levels of motivation become very low. So what is an organization or a company to do to begin to deal with these kinds of problems? The first thing, before taking any kind of action at all, a company has to establish its own credibility and establish credibility with their employees and staff. In order to do that, the company leadership and managers need to revisit the values and the vision that they have for the organization under the current set of circumstances. They need to revise strategic plans to make them realistic for what they can do realistically proceeding from this point on, and need to revisit what they consider the employee's role within the company or the organization. They need to recognize that the company is dependent upon a healthy workforce, and they make the commitment to the employee's safety and their well-being. It is important to be mindful as well in this preliminary stage, to be aware of your own thoughts and feelings, and to know that what you express is going to be observed and is going to affect other people. So how we cope and how we behave is going to influence how our employees and staff are going to cope and how they're going to behave. And it's okay to acknowledge that we're having difficulties with this. We don't have a playbook and we're kind of making it up as we go. That's perfectly legitimate because that's honest. But what we also want to do is make that commitment that together and working together, we will find a way to go through this. One of the ways in which the cognitive model comes into play in this is our thinking about the situation, about the world that we're in right now, about how it's affecting us. But the cognitive model will say that it isn't the situation itself that is going to overwhelm us with negative feelings and negative thoughts, but more it is how we think about the situation that is going to affect our feelings, our coping abilities, and our ability to adapt to things. So what we can also do, besides just focusing on the negative stuff, think about our values and our aspirations, about where we're going and the positive things that that can bring about for us. So our founder, Dr. Aaron Beck, is very fond of saying, optimism is a choice. Be very clear about this. I'm not talking about being Pollyanna-ish. We don't dismiss or disregard the negativity or the negative things that are present. It's a simple matter of having a balance between the two, that sometimes we need to think about and deal with the negative, but we can't ignore that there are positive things that we can have to look forward to, and focusing on those is a choice that we have and something that can change the tenor of everything that we do. We want to improve communication at work, and we want to understand with our staff and employees what is their preferred mode of communication. Some will want a text, some will want a Zoom meeting, some people will want an in-person meeting. So we want to try to figure that out and deliver that as best as we can to all of the people who have that. We want to decide in advance, what is it that we want to convey and what is our attitude? The tone of voice that we use, our posture, our gestures, eye contact for in-person meetings, all of those things affect the message itself. The content itself becomes very important in written communications, but all of those other things come through and are very important as well. So as a reminder, those things that I was just talking about are those things that we do before we start anything. We figure out those things, we get our vision, our aspirations, our positive attitude, we recognize what we want to convey, and then we start with the early intervention work. And what we want to do is to stabilize the situation. This comes from the ideas of psychological first aid that were crafted by the National Center for PTSD. Although these principles were used long before that, they just happen to contain them. So what we want is to bring a sense of safety, calm, efficacy, make connections, and bring hope to the people. So how do managers do that? The specific task for managers to bring about those things is to listen, to observe, to protect our staff, and to connect them. So what do those mean? For a manager, a supervisor, an HR director, we want to create opportunities for employees to talk. And when they do, we want to listen to what they say, listen to their ideas, observe their emotions. We want to look for behavioral changes from how they were before all of this started to what it's like now. What are their interactions like with their coworkers, with you as a supervisor or a manager or an HR person? And to what extent are they participating in team activities that compared to how they were doing before this? We want to protect them. So how does a company protect its people? Well, we do that by informing, first of all, everyone what the company is doing in order to keep everybody safe. The company, the organization will develop policies and procedures regarding hygiene, and as much as possible, try to maintain the routines, the activities, that structure that was in place beforehand. I recognize that that's very challenging when you have people working off-site, but we also know that many organizations have become very creative in bringing people together and keeping regular meetings ongoing and keeping the structure of the organization together as much as possible. It's important to be clear about expectations and rules. On the one hand, you kind of feel sorry for people and you want to be lenient, but on the other hand, people really need clear direction and rules and expectations. So don't cheat yourselves or them from having them have a clear sense of what is expected of them out of a fear of making them uncomfortable. And we should avoid making promises that we can't keep. We should try to avoid saying things like everything is going to be okay, because for some people everything is not going to be okay. But what we can say is that we are going to try our hardest. We're going to do everything we possibly can to be helpful to get things in place. And we want to be watchful for people who are engaging in bullying or harassment. Some people are being harassed for wearing face masks now. People are being harassed for a whole variety of different things. We want to make clear that our policies are that we don't tolerate that kind of behavior and that we want to resolve those kinds of issues. We also want to make it clear that it's important that people take breaks. If you talk about trauma all the time and everything is about trauma, it's going to be hard to get past the trauma if that is the only thing that you talk about. We want people to get connected. So we want you to check in with employees. We want you to answer questions simply and honestly. And saying, I don't know, is perfectly legitimate if that is the honest answer. I would follow that with saying something like, but here's what we're going to do to try to get in control of it. Let people know that other people are struggling too. Nobody is alone in this, and we want to empathize and keep communication open as much as possible. We want to restart activities that people can participate in together. We want to find resources. Some people will need help paying their bills. Some people will need help giving care to other family members. People will need resources for a whole variety of things. To the extent that we're able to help them to do that, that is going to help to stabilize their situation and make them a better employee. We also want to build on their strengths. What are the things that they already know how to do well, that they're accomplished at, and that make them feel good? So in doing all of those things, we want to try to avoid saying things like don't feel bad, don't cry, try not to think about it. Those kinds of statements tend to minimize the employee's experience, and they will think that you don't get it, you don't understand. So, and it's going to diminish the importance that they place on it, and they're not going to feel safe with you talking about those kinds of things. So what we want to do is think about what kind of relationship do we want to have with our employees, our staff members on a long-term basis. So and then we want to translate that. If this is my long-term aspiration to have this kind of relationship with the workforce, with the staff, with the employees that we have. What can I do today that is going to set the foundation? And putting the things that we were just talking about into place. Pick one of those things and start working on that, so that that will help you to start building the path toward that long-term relationship that you want to have. Some of the things that you can do: make sure that people know that they can clock out at the end of the day, that they're not expected to be on the clock all the time. Let people take PTO. Create conversations that have a stigma. Talk about uncomfortable things. Provide a safe environment that allows people to do those kinds of things. Help people to stay connected. Increase permission to empower people to manage their own lives, their priorities, and make decisions that will affect them. And try to reinforce the strengths and the positives. Again, get back to normal routines, not just at work, but at home as well. Make healthy lifestyle changes. Those are the kinds of things. The healthy lifestyle changes are going to be things that are going to bring about emotional regulation. So these things that we've been talking about in this section are about how to set people on a positive course. Now, what do we do when we recognize that people are having trouble? How do we approach them? So we talk with them, and we report to them what we've seen, what we've heard, what we've been told. We express concern for them, and we ask them if they're willing to talk with us about this. So we need to be clear about this too. Is there a bottom line? Because we can talk about these things in regards to what's going on in a person's life, but unless it's impacting their work performance, then it's just being a support to them and a resource to them. But if there's a bottom line that you need to deliver, that if you keep doing this, or if something doesn't change, we're not going to be able to continue to employ you, then you need to deliver that message at this point too. People need to know where they stand. But in this conversation, be very clear that in order to say that a person's job is in jeopardy, then you will need to have documentation to support the fact that their job performance is not living up to the expectations that you have. After you deliver that message, you can ask the question, what do you think about what I said? And we want to show genuine respect and listen to what they have to say about what we've just said. They will have explanations, they might have excuses, they might own it entirely, but we want to respect them. Some people will want to talk a lot, some people will not want to talk a lot about it. Either way, we don't want to make a judgment about them. We want to hear their views, and we want to know what they want to do. And while they're talking, we want to pay attention, and we want to listen, we want to nod, smile, to let them know that we're present with them. We might need to ask, what do you mean by that, in order to get clarification? This is a good time to use reflective listening. So you feel, I hear you saying, tell me if I've got this right. And if you're really having trouble following a person, then using summarizing is one of the best things to do. You can say, now, what I'm hearing you say is this, and this is a good way to summarize and make sure that you're capturing the whole thing, and also give them the opportunity to correct it if it needs that. So this is a process. It's not one conversation is going to fix everything. Ultimately, what is important is, what does the employee want to do? What is the employee's aspiration? What do they want to be a long-term employee? Do they see themselves going off doing other kinds of things? What kind of relationship do they want to have with the organization, with their families? And so this conversation about them changing things can be housed in that. Ultimately, what do they want on a long-term basis? We can talk about what are all of the options that they have, and then ask them, what is the first thing that you could do to start moving in the direction that you ultimately want to have happen. We ask them, so how committed are you to this? How much do you really want this? And would it be helpful to you, or would you be willing to come back and talk with me about this again? So those are the kinds of things that where we take the problems head on, we address them and tell them what the consequences may or may not be, and begin a working relationship with them to do that. Now, for the part that applies to all of us, dealing with the stress and the problems that we have within life. So the first of these is the healthy lifestyle. And these are common things that people know about. But when people are saying, I don't know if I'm using my time well, I'm wasting my time, I don't know about it, we can ask them to work on a schedule, or we can work on a schedule for ourselves. Two things are important in this regard. One is that we begin putting things in our schedule in which we're able to have some mastery and that give us a sense of accomplishment, things that we do well. And the second important thing is that we put things in our schedule that give us enjoyment. And we can do this with a formal schedule, or we can just make a list of things that we want to do. Next, sleep is one of those things that is often interrupted. And most people know that things like caffeine, alcohol, nicotine can interfere with sleep, and eating a heavy meal before going to bed can affect you. Exercise can be good if it's done in advance of going to bed, but it can interfere with sleep if you do it right before bed. But here are some of the other things that are deal makers in terms of whether or not somebody is able to sleep. Are they willing to go to bed at the same time every night and get up at the same time every day, 7 days a week? Find the quietest place that you have in your house or your environment. Having it dark and cool is more conducive to sleep than warmer temperatures. You dedicate the bed to two activities, sleep and sex, and nothing else. No TV, no reading, no eating, no phone, no Facebook, none of those things, because this is a reconditioning process. You're conditioning yourself to recognize that the bed is for a single activity and not for those other things, so that when the body and the mind go to the bed, they will know time to go to sleep now. Turn off all the screens, turn off the phone, limit daytime naps. Decision making in regards to many things that are changing in our lives now, we have decisions to make. In CBT, we use a common cost-benefit analysis for cell grid, so that we would ask and make a list under each one of these categories. If I have a decision to make about work, what would be the advantages of me doing this? What would be the disadvantages to me of doing this? And then what would be the advantages to me for not doing that? And what would be the disadvantages to me for not doing that? So we can lay it out and we can prioritize those things or weight those things. And from there, it can help us to make decisions. Sort of a shorthand approach to that is an acronym of ITCH. That is, we identify a problem. I have this problem. We think about what are all the possible solutions to that. And then we just pick one of those. And then we implement it, and then we follow up and see how well did that work for us. Relaxation is one of the things that people talk about often. Relaxation, mindfulness, things like that. People also say that they don't have time or they don't feel comfortable doing those kinds of things, but there are true benefits for managing stress, depression, anxiety. It can retrain our brain to respond thoughtfully instead of impulsively to problems and situations that we have. And it can help people to maintain the gains that they've already made. I'm going to discuss a 1-minute breathing exercise. And this is something that counters all of those arguments that I don't have the time or the place. We breathe in through the nose, we hold it, and then we breathe out. We breathe in for 4 seconds, hold it for a couple of seconds, and then breathe out slowly through the mouth for 6 seconds. If we do that 4 times in 1 minute, research tells us that you will be able to reduce your heart rate and your blood pressure by doing a 1-minute exercise. I would encourage you to use that. Distress tolerance comes about accepting the world as it is. We acknowledge the facts of the situation. It doesn't mean that we approve of it, that we're resigned, or that we're being passive. In fact, and it's not anti-change. In fact, acceptance and coming to terms with things is often preliminary to being able to deal with things effectively. It's similar to the serenity prayer, in that what we're looking for is the serenity to accept the things that we cannot change, the courage to change the things we can, and the wisdom to know the difference between the two. Interestingly, when people come to accept things on their own terms, it's sometimes accompanied by sadness or grief. People have trouble letting go of those things that they can't control. And sadness and grief is one of the things. But in coming to terms with acceptance, when we then want to take control of those things that we can, here's a list of activities. Again, the acronym accepts. So there's a list of exercise that you can tolerate, to leaving the situation, to holding ice and squeezing a ball. A number of things that will help you to take action to mostly deal with those things that you have control over, which is mostly dealing with yourself. And when all else fails, radical acceptance, that is accepting life on its own terms and saying yes to life just as it is. In a sense, radical acceptance is, it is what it is. And that isn't just a cliche. Here's just a short decision tree that will help to go through these things that we were just talking about. Is this something that I care about, the thing that is causing me stress? And if the answer to that is no, then go find something that you do care about, and then explore your values and aspirations in regard to that, and put into action those things that will help you to achieve that. On the other hand, if this is something that you do have, that you do care about, the first question is, do I have any control over it? And if not, then going off to in the acceptance direction, breathing and mindfulness will help you to do that. Emotion regulation, eating, exercise, and sleep. Those are things that will help you to accept. On the other hand, if change is what you're after, again, breathing can be helpful for this to get you in the right mode to begin making those changes, and then a cost-benefit analysis, asserting yourself, and planning activities of all sorts. So in summary, these are the things that we've been talking about. The impact of trauma, ideas for how a company or organization can take actions by setting the foundation, doing early intervention, and then how to address the problem with individuals when the need arises. And then additionally, using cognitive behavior therapy techniques for individuals, for ourselves, and passing them on to our employees and staff, healthy lifestyles, activity planning, sleep hygiene, decision-making, relaxation, distress tolerance, and acceptance. And so with that, I'm going to bring it to my presentation to an end. I thank you so much for being here and for listening to this presentation. And at this point, I welcome any questions that you might have about anything that I've talked about, or anything else that I haven't talked about that you think would be helpful. So thank you. Carla?
Dr. Miller. Oh, Dr. Miller, thank you so much for such relevant information and some actionable steps that employers can take and share with their managers and supervisors. I have seen a number of questions come in, and I am going to turn it over to Carla Chin, our Director of Wellness, to facilitate the QA period. The one thing I do want to mention to everyone, after this session, we will be sending out a survey, and if anyone wants more information from Dr. Miller and the Beck Institute, or wants to be connected to them, please let us know, and we're happy to make sure you get connected to those resources. So with that, Carla, I'm going to turn it over to you.
Perfect. Thank you. And thank you, Dr. Miller. I think we all learned something today, and it's been so useful personally as well. So as far as our questions, the first one that came in is asked here, how do you balance support with the need to be productive and present during these times?
Yeah, that's one of the big questions, isn't it? So what we try to do in this regard, first of all, I think it's important to have open conversations with people and to be honest that we are trying to find a way to find this balance right now. One of the things we don't want to do is put ourselves in the position that we have to figure this out and we have to know the answer. Because in many situations, many times in situations like this, we don't know the answer, and we kind of have to work together with our staff and our employees to figure out what is workable. I might have ideas that I think are perfect, and they might not think that they're as workable as I think. So I think the first step is having that open conversation, being honest that I don't know what the answer is, but clearly we have these two things that we have to reconcile. We want to have balance between the need to be safe, to be healthy, but at the same time, we do need to set production standards. And I think that probably having that conversation and having it openly with the employees is the thing that I would do, because more times than not, I have found that staff members have ideas that I haven't thought about. And the other thing is that they really know what is more palatable to them than I do. So many times the staff members and employees have come up with better solutions to the problem than I have. So that would be at least my starting point with that. And then what we want to do is develop to support the ideas. So we have to build the structure around that. We might have to put policies and procedures into place, and we might have to talk about consequences. But before all of that, I think having the credibility with them and demonstrating the respect that we have for them, not just as employees to do what we tell them to do, but to be problem solvers and to be actively engaged in this process, is one of the things that will be most helpful in getting them engaged, and then they become a part of the solution rather than us just telling them this is what you need to do in order for us to find that balance.
Thank you for that. Our next
Did that
question.
Answer the question?
Yeah, I think that was helpful. And if you'd like Dr. Miller to dive deeper in that, certainly can submit a follow-up question. Our next question asks, how do we help employees overcome fears about face-to-face encounters or employees that refuse to return to an office?
Yeah, I didn't hear the first part of that. Employees who are concerned about what? Say.
Face-to-face encounters.
Oh, face-to-face encounters. Okay. Well, okay. So I think there are multiple things here. One is, as I said early on, that you need to have policies and procedures in place, and the organization needs to take a stand. What is the position of the organization? Now, after you establish those, we're going to assume that you've taken into consideration the safety of employees as much as you possibly can. We want to then convey what you've done, what the policy is, but also what are the procedures, and also what kinds of resources or materials are you making available to the employees in order to minimize the risk. This is another place where I think we have to be honest about safety and well-being. Can we completely eliminate the risk? Clearly we cannot, and that's unfortunate. So that's one of the kinds of things that we don't want to make a promise that we can't keep. We don't want to say we're going to eliminate all risks, so it will be perfectly safe for you to come in here. We have to be honest about that. And I think that being honest about that is going to increase our credibility and our trustworthiness with the people that we want to have engaging in face-to-face encounters. So now, when it comes to being concerned about the face-to-face encounters, they're already going to know what the organization's position is. They're already going to know what are the resources, the supplies that we're going to make available in order to reduce the risk. And then I think for that person who is still concerned, a one-to-one conversation with them about, well, what is it that you're most concerned about? They may be concerned about things that are legitimate, and they may be concerned about things that are not. I'm reminded at the beginning of this, there was a great deal of concern about worrying about bringing groceries home and how you had to, disinfect everything that you brought into the house. But over time, and with a little bit of experience and time, we found that those surfaces did not pose as much of a risk to us as what we were initially concerned. So good information is something that will be helpful. For the next step for using those supplies and techniques, it would be perfectly reasonable for the person who has concerns to feel empowered to enforce those with a person that comes near them in their space. So I went into a store one day and unintentionally, I came too close to a worker in the store, and the worker said to me, "Back off." Well, I got the message very quickly. So now I was an easy target for the person, but at the same time, people have to feel empowered that it's okay to tell people to back off and to maintain the guidelines and the policies that are, and procedures that are in place. So all of that being done, the company doing everything that it can, having policies and procedures in place, having the supplies in place, having the employees feel empowered to enforce all of those things. And then finally, if a person is still too worried to come to work about that, then in the most comfortable way possible that I would imagine, I would ask whether or not they believe that their concerns are legitimate or out of range, and would they benefit from talking with somebody through the employee assistance program or somebody provided through the benefits program. That's it.
Thank you. Okay, our next question. What do you do if you confront someone who you think needs help or medical intervention, but isn't open to receiving it?
Yeah, this, of course, is one of the hardest problems of all. So a couple of things that we have to keep in mind. Because somebody is exhibiting unhealthy behavior, and let's assume for the moment that they're not putting anybody else in danger, but just that they're exhibiting behavior that is not in their best interest. As an employer, we're hard put to make it mandatory that they do things that are healthy for them. Now, some employers, healthcare systems, hospitals are not hiring people who use tobacco products and things like that. That's a different kind of thing, I think, than where we're trying to set up rules on the fly. So if somebody is engaging in unhealthy behaviors, but we don't have any evidence that it's affecting their work performance, then we can express our concerns to them, we can offer our help to them, and we can keep the door open that they can come and talk to us anytime. Now, the other scenario, if indeed whatever the behavior is that they're engaging in is affecting their work performance. They're not coming to work on time, they're taking long breaks, they're not getting their projects done, they're not getting their work done, where their work performance is absolutely a factor. Then we want to make sure that we document all the ways in which their work performance is affected, and then we decide what kind of action we're going to require. We might start with saying, I know that you don't recognize that the things that you're doing are affecting your work performance, but we think that it is, and you can start with making a mandatory supervisory referral to the employee assistance program or to another healthcare provider as you think is appropriate, or you could make a mandatory referral for a comprehensive work or a fitness for work evaluation. And so those would be the things to do, I think, that if it's not work related, just be as supportive as you can. If it is work related, then you begin by making mandatory referrals for fitness for work, for employee assistance program, and then to follow those recommendations and following those recommendations a condition of their continued employment until such time that their behavior would so negatively impact the company, the organization, or put other people in danger that you would have grounds for termination. But those kinds of things would be articulated in your HR policy, and that's the process that you would want to follow at that point.
Great, thank you. I think we'll take one or two more questions, just to be respectful of everyone's time and ending it on time. This question asks, can you speak to how these events and trauma may affect ACEs scores for individuals and society?
How these things are going to affect individuals and society today, going forward. So I just want to make sure I understand the question.
Yeah, there's not much more context, but I would interpret it as how these events, I mean, perhaps the pandemic and the compounding of stressors can affect adverse childhood experiences.
Yeah, boy, it's a wide open question, and I really wish I knew the answer to that. I can tell you what I hope would happen, but largely it's speculative on my part, and without a crystal ball in hand, it will be hard for me to say something that I would bet my paycheck on. But that said, I think that, there's plenty of evidence that people are really tired of all of the restrictions that have been placed on us, and that people just want to be done with this. They just want to be over with it. And that is certainly understandable. I think also that is at least part of the explanation for why we're seeing a resurgence in infections, because people are tired of following the guidelines provided by the CDC and other health professionals, and they just don't want to do this anymore. And so I think they're becoming lackadaisical in their attention to the guidelines. So in the short run, what I'm predicting is, well, I would even say I don't think we're finished with phase one yet. But if we use the current behavior as any indicator about how things are going to go in the future, then phase one is going to continue, and we will have a phase two. So that is going to wreak havoc on individuals. It's going to wreak havoc on families. It's going to wreak havoc on the workplace. At the same time, I want to remember what I said earlier about the cognitive model, and that is that optimism is a choice. And when we think about optimism, this is a time when organization and employers can hit the reset button in terms of their relationships with their employees, their staff, and think about what you want to have to be true on the long term. And in that sense, I think that there's a great opportunity for employers of all sorts to hit that reset button and to reestablish relationships and to have a more loyal, committed workforce than ever before. I think that one needs to do those things to earn the credibility in the first place. And when you establish that foundation of having credibility, that your employees believe that you care about their safety and their health, and that you're working together as a team, I would see that many positive things could come about that. I would love to speculate further about the economy and things like that, but probably that's beyond my expertise, even though it's something that I would love to talk about off record.
Thank you. And just a final, I guess, as far as your final thoughts on this, one question, which has been a question I've personally had as well, that we're trying to help, work on as well with our organizations that we're working on with Exude and our clients. And what are some effective ways and strategies for normalizing mental health in the workplace?
Yeah, geez, we're getting all the easy questions, and we're going to finish on one of those. Stigma about mental illness is not new. Surprise, surprise. I think one of the things that we can do is to begin to normalize conversations about mental illness. So it isn't just, what do you say to somebody who has problems, or how do you deal with them? This is about everybody else talking about it too, like about having conversations about mental health issues in staff meetings or in other places, without identifying individuals, but just talking about the impact that life's events are having on individuals, and to recognize, going back to what I talked about very early on, following trauma, people experience depression, anxiety, they feel isolated, they have all kinds of negative reactions to the things that are going on in the world. And I think that it would be very valuable for it to be an open topic of communication, to say, look, I'm having trouble, and that's normal. Or for other people in supervisory or management positions, to say, look, I understand that with everything going on in the world, people are going to have trouble, and that's normal to have trouble. I would say that one of the big problems about the stigma of mental health is that we have a stigma associated with even talking about not mental illness, but mental health. We don't talk about the things that will help us, and the importance of doing the things that will help us to stabilize and to forge forward on a path of positive growth and health. And I think talking about those kinds of things openly would be a big step in going in the direction of being able to have the conversation about the people who are having problems, and the difference between normal and abnormal, because that isn't such a broad line between normal and abnormal. That's a very porous line, and I think that having conversations about that would be a great first step.
Perfect. Thank you. All right. So I just want to thank you again, Dr. Miller, on behalf of Exude and everyone here that's been able to attend and gain from your wisdom. For everyone else that's still on, this will be shared via recording, so you should get an email shortly with regards to accessing this presentation. And if you have any questions with regards to Dr. Miller's session or any upcoming Exude events, please feel free to reach out to us. We are happy to have more conversations around mental health and other meaningful topics that can help your employees. So with that, I hope that everyone stays well, stays connected, and stays healthy.
Thanks, everybody.
Bye-bye. Thanks.